So I was born and raised here in Oakland. I went to Oakland Public Schools, and I always kind of liked science. And so when I went to undergrad, I majored in whatever major you would go into for genetic engineering. This is what I remember, because at that time that was like a new big thing. And I realized that was not for me at all. Didn't care for the lab. But I was working as a tutor. I actually worked as a tutor since high school. And I just really loved being able to explain kind of complicated things to people, no matter what level that they were at. And so at some point, I think in my last year of college, I kind of had that aha moment, like that's what doctors at least should be doing. And so I decided to go ahead and apply to medical school. And I went to Howard University School of Medicine, and then I did my residency down in Southern California. But I knew I wanted to come back home and serve my community here in Oakland, and so that's what I did. When I started practicing, the Alliance has been the largest, Medicaid managed care organization. And so I've always enjoyed working with the Alliance because you get that personal service as a provider, and also our patients do too. And when the opportunity came up to serve in a leadership role with the Alliance, I felt like it was really important, because I think as important as the work that we do on the ground serving our patients is, it's also, I think, important to be thinking at the population level and how we're covering hundreds of thousands of people who receive Medicaid in our county. And so it's been really helpful for me just to understand all sides of what it means to be a managed care health plan, but also just knowing that the Alliance really is rooted in the community as well, and that there are actual people that you can talk to. You don't have to, call an 800 number and never get any kind of, real help. So patients feel that they can get what they need, and providers feel that they can get what they need. And with so many changes happening all the time, but especially now at the state, I think it's important for me to be able to bring my community lens in the work that we do, which is so much far beyond, treating diseases, and it's so far beyond what just goes on in the exam room. And I think the Alliance understands that there are so many things that contribute to health besides just the absence of having a disease. And so it's a really also critical time. So I was really honored to be able to join the board and to now be in a leadership role there too. So I love to cook. I like to walk. I just like to get out and get fresh air and make sure that I do that every single day or as often as possible. And I am the proud mom of 3 sons. Roots Community Health Center is a really special place. We started as kind of like a think tank and volunteers. And so we started out as like a mobile volunteer operation going around East Oakland to really understand why we have the disparities that we have, and really, I think, approaching it with more questions than answers. And in that pursuit and in that journey, really just learning and figuring out how to actually provide what's needed, even if it wasn't even necessarily a medical service. It could have been something about food or housing or something else that someone might need to be healthy. And since starting as a 2-person volunteer operation in 2008, we hired our first staff person in 2013, and now we have over 200 full-time staff, all working towards our mission, which is to uplift those impacted by systemic inequities and poverty. And our team is incredible and is really contributing to helping folks transform their lives every single day.